For symptoms of nephrotic syndrome, children with NS nephrotic syndrome initially present with facial and periorbital edema that progresses more widespread edema, including abdominal swelling, lower extremity edema. The early stage of disease may be mistaken for an allergic reaction. Anorexia, malaise, abdominal pain, diarrhea due to intestinal or edema, and respiratory distress due to presence of outside and/or pleural effusion may be present. MCNS is characterized by absence of gross hematuria, renal dysfunction, and hypertension. To distinguish between nephrotic syndrome and glomerulonephritis, nephrotic syndrome is diagnosed when there is too much protein in urine and too little bloodstream. Normally, the function of the glomerulus is to prevent the leakage of the protein. If inflamed glomerulus podocytes, it will cause proteinuria. But 3.5 gram per day, hypoalbuminemia, edema, and other low proteins, immunoglobulins, higher risk of infection, antithrombin-free, hypercoagulable stable state, hyperlipidemia can also be caused clinical findings. Periorbital edema, ascites, peritibial edema, proteinuria, high blood pressure. Nephrotic syndrome is a kidney disorder that leads to excretion too much protein in the urine. Proteinuria, this condition can occur in both children and adults, and its hallmark symptoms result from the loss of the protein and subsequent imbalances in the body's fluid and other systems. His symptoms include edema, swelling, one of the most noticeable signs, particularly around the eyes, periorbital edema in the ankles and feet, and in more senior cases, the abdomen. Aside, the swelling can worsen throughout the day and may be more pronounced in the lower body due to the gravity. Foamy or furry urine caused by the excessive protein leaking into the urine. The protein, when agitated as during urination, can cause the range of hair, foamy, a rapid weight gain due to fluid retention and accumulation in the tissues not related to increased fat or muscle tissue fatigue, and weakness, generalized feeling of tiredness, and decrease of energy levels, partly due to reduced protein in blood, which can affect overall metabolism and muscle function. Loss of appetite may occur due to the buildup of fluid in the body. Also, general symptoms of feeling unwell, hypoalbuminemia, low levels of albumin in the blood, a direct result of protein loss through the kidney, while narrow symptoms is a key diagnostic marker and contribute to hyperlipidemia, elevated level of fats, lipids in the blood, including cholesterol and triglycerides. This can occur as the liver increases lipid production. In response to low protein, increased risk of infection, especially infections that involve the peritoneum, peritonitis, or the respiratory symptom due to the loss of immunoglobulin in the urine and altered immune function. Vitamin D deficiency can occur due to the loss of protein-bound vitamin D in the urine, potentially leading to bone weakness or pain. Blood clot, thromboembolism, increased risk due to changes in blood clotting mechanism, often related to the loss of anticoagulant proteins through the urine. Hypertension, high blood pressure can occur in some cases, related to fluid retention and possibly alteration in kidney function that affect blood pressure ablation. Nephrotic syndrome can be primary kidney disease or secondary to systemic disease like diabetes, lupus, and infections. The underlying cause of the nephrotic syndrome significantly influences both the presentation and management of these symptoms. Early diagnosis and treatment are crucial to manage symptoms, prevent complications, and treat to any underlying conditions contributing to nephrotic syndrome. So, for symptoms of nephrotic syndrome, children with NS initially present with facial and periorbital edema that progresses to more widespread edema, including abdominal swelling, lower extremity edema. The early stage of disease may be mistaken for allergic reaction, anorexia, malaise, abdominal pain, diarrhea due to intestinal or edema, and respiratory distress due to presence of ascites and or pleural effusion may be present. MCNS is characterized by absence of gross hematuria, renal dysfunction, and hypertension. To distinguish nephrotic syndrome and glomerulonephritis. Glomerulonephritis. Nephrotic syndrome is diagnosed when there is too much protein in the urine and has too little bloodstream. The function of the glomerulus glomerulus is to prevent leakage of the protein if inflamed and glomerulus. Podocytes, okay. Podocytes, it requires proteinuria 3.5 gram per day, hypoalbuminemia. Edema and low stock proteins, immunoglobulin, high risk of infection, antithrombin 3, hypercoagulable state, hypolipidemia can also cause follicle finding periorbital edema, ascites, pre-tibial edema, urine, high blood pressure. The Brody syndrome, edema, swelling, foamy or urine, weight gain, fatty and weakness, loss of appetite, hyperlipidemia, increased risk of infection, vitamin D deficiency, blood clots, thromboembolism, hypertension.